You talked about this at the beginning about the patient and physician relationship and how that is being affected by the amount of time we're able to spend with our patients being truncated, and we just have to rush through every interaction. In terms of your feelings of job satisfaction, how has that changed when you transitioned over to this value-based model?
Well, it's not that we have a long visit every time we see our patients, but we're seeing them frequently. So you really get to know them. And I feel like my patients are my friends and I've gotten to know them pretty well. So I think that makes for a lot more satisfaction because it's easier to see patients that you know, but it's also easier to make a difference for them as well. You get to know them on a whole different level. It is a mindset and a different skill set than it is in fee for service because it's not about just doing the visit and documenting the note and getting paid. It's really about thinking about what is the next thing to do. We don't want to give a patient too many things to do because they won't remember. So we want to do the one or two next things we need to do for each patient to make a difference for them and then see them in 2 weeks or a month. And then what's the next step from there? It's just a truly refreshing way to take care of patients.
Because you're coaching them for health.
Yes.
And it sounds like because you're able to see them so frequently, you get to know your patients, you get to understand what is important to them and
Right.
collaborate with them in terms of improving their individual health and lifestyle.
Yeah, I mentioned Dr. Barnett earlier. He wrote a few books. He had a turn of phrase in there that he talked about working with patients, working to consensus rather than achieving compliance. I hear a lot of people talking about the patient's non-compliant. I prescribed the pill and they wouldn't take it, but the patient has to make the decision. So we really have to figure out what their motivations are and work with them and hopefully help them to make healthy choices, but they have to make the healthy choices. We don't get to make the choices for them.
That's so true. Then when we talk about full risk value-based care, isn't that a little bit concerning? If you make recommendations for a patient and they, for whatever reason it is, decide, no, I don't think that's really important right now, but then their condition worsens.
It is. You're absolutely right. So that means that we have to think about different ways to approach the patient. You got to walk the line between creating a rift between you and the patient, but you have to keep coming back at it in different ways and working to convince them to do what we need them to do to make the healthy choice for themselves. And we talk about accountability, and I sometimes like to rephrase it responsibility, meaning the ability to respond. I heard Scott Conard, who is a physician leader, talk about that you can take 100% responsibility for world hunger. Doesn't mean that you can personally end world hunger, but if you want to, you can write a check of what you can afford to the local food bank, and you can respond to world hunger. So what I would tell one of our doctors is we need you to take 100% responsibility for your patients and their outcomes, but not 110% responsibility. Part of your 100% responsibility is helping them take their 100% responsibility for their own outcomes. And so how do you engage them to do that?
For us, by us, and just for us, this is hope for med.